When measuring edema, it is important to always measure both sides for comparison. To save time for this video, I only measured one upper extremity for each measurement. I secured a photo and video release. I received written consent to use my patient for this video purpose. Hi, I'm Jalissa. I'll be your OT today. How may I address you throughout our session?
You can call me James.
Hi, James. It's nice to meet you.
You too.
So I heard that you have been experiencing a little bit of weakness on your left side, like around your wrist and your hand.
Yeah.
Are you having any pain today?
Yeah, not too bad, but I have some.
You have some? Okay. What would you rate it between 0 and 10, with 0 being no pain?
Probably a 4 or 5 today.
4 or 5 today? Okay. Could you point to where your pain is?
Like mostly right here.
Okay. So it's like right in here. Okay. Perfect. So we're going to do, I've noticed that you have a little bit of swelling, so I'm going to test your edema today. So edema is just swelling that you have in your hands. And we're going to compare your right and your left sides.
Okay.
So you're having a little bit of swelling and pain in your right side.
Yes.
Okay. Perfect. So the first thing we're going to do is measure the edema using this tape measure. Okay, so if you'll put your hand up there for me. Is it okay if I touch you?
Yes.
Okay. So I'm going to do it like here. Locate your pisiform, which is right there. Go across the metacarpals. Okay, it's measuring at 42 centimeters. Okay, James, so now we're going to measure your edema using this volumetric device.
Okay.
So what you're going to do is you're going to stand at the edge of the table with a little bit of room, and you're going to reach in with your hand just like that, and I want it to go between your ring finger and your middle finger. The little it's like a little dowel or something right there. Okay, so just go in slowly. I'm going to come on this side of you. Okay, you can gently come out. Have you some paper towel here.
Thank you.
You're welcome. I'm just ensuring that we got all the drops into the beaker. Now I'm going to transfer it to the graduated cylinder. Okay, this is in milliliters, and we have it's about 385, between 380 and 385 milliliters on James's right side. Okay. So I'm gonna first measure across your metacarpals. 21 centimeters. 22 centimeters. 16.6 centimeters. 22.2 centimeters. .9 centimeters. .7 centimeters. .5 centimeters. The last one. Sorry, James, it's gonna be a little uncomfortable.
That's
I'm gonna go under your arm. Some possible interventions I could do to treat the edema in James's right hand is the RICE method, which is rest, ice, compression, and elevation. I could also give him a retrograde massage. I could use Coban to wrap the digits of his hands to reduce the swelling. I could offer him compression gloves or sleeves to reduce the swelling. And I could assign him active fist pumping exercises. Client presents with swelling, pain, and discomfort in his right hand and wrist as a result to a previous scaphoid fracture injury. Client reports his pain rating between 4 to 5, with 0 being no pain and 10 being the highest. Client expressed his desire to return to full activity at his work as a contractor. Client informed me that he took his pain medication within 30 minutes of coming to OT. Client participated in 45-minute OT evaluation at Outpatient Rehabilitation Center to address his reach, grasp, release skills during work activities. Client's dominant hand is the right hand, which was previously fractured. Upon assessment, using Figure 8, girth measurements, and volumetric measurements, client's right extremity was significantly swollen when compared with the left. The edema measurements were indicative that there was swelling and loss of range of motion in that hand. Client was instructed and sent home with hand strengthening exercises and therapy putty. Client would benefit from continuing OT 2 times per week for 6 weeks.